One day your child seems like themselves. The next day, they're completely gone. They're different. You can probably name this day where the tics started to appear out of nowhere. They started to have OCD-like behaviors that took over the entire household. Their handwriting fails, it starts to fall apart. And the kid that was dry for years, they start to wet the bed again. The food gets refused, and it's not from pickiness, but from fear. And the rage literally takes over your child and leaves the entire household shaken. And there's really nothing that you know what to do. You've gone to the pediatrician, you've seen the neurologist, even a psychiatrist. You've been told it's Tourette's or ADHD, and just to learn how to live with their anxiety. You've been told how to manage it and that there's really nothing that you can do. But you know your child, and you know that there's something larger happening underneath. The gut feeling you have, it's real. And you're not alone because other families are dealing with this. This is what families walk into when their child starts to express symptoms with PANS or PANDAS. And it's a daily life. You can go a little bit deeper than just the label, and you can understand what's actually driving it. And you can actually get your kid unstuck if you start doing the things in the right sequence. This discussion today is for parents whose children's lives were changed suddenly, whether motor tics, OCD, rage, food restrictions, separation anxiety, just overall regression. It may have followed a strep infection or any other illness, and it really came out of nowhere, which is the scariest part. It's also for families who have actually gotten the diagnosis of PANS or PANDAS, who've been through rounds of antibiotics, they've done the biomedical protocols, taken the supplements, and even seen the specialists. Yet you're still watching your child suffer, and they're doing the right things, but it's just not holding. And this is what we're here to speak about today. We're going to go ahead and break down what PANS and PANDAS actually are. And we're going to touch base on the sudden onset of signs that simply sets these two conditions apart. We'll address the nervous system and how the vagus nerve is actually at the center of these flare-ups. We'll discuss this perfect storm of early childhood stressors that make children vulnerable while others are left untouched. We'll clarify why conventional care oftentimes plateaus with these particular kiddos, and why functional, integrative, and biomedical approaches do so amazing, yet frequently get stuck in the middle, and they're not addressing the root cause of the issue. We'll get into the sequence, the framework, and the batting order, which is where you can do the right things in the right order to help your child get unstuck. We'll talk about how to test for this missing piece of the puzzle with PANS and PANDAS discussion, using something we call neuroinsight scans, which look deep into the functioning or dysfunctioning of the autonomic nervous system, and finally how neurologically focused chiropractic care supports regulation, adaptability, and lasting progress. I want to touch base on a practice member, a little boy named Caleb. He was in the middle of his 4th grade. His family watched their once lively little boy get pulled under by major motor tics, mood swings, and trouble focusing. Part of the picture was the PANS diagnosis. A neurologist added a Tourette's label. A psychiatrist actually cycled this little boy through rounds of medications for anxiety and ADHD, which showed very little improvements. His grades continued to drop, his confidence continued to drop, and he felt like a social outcast at school. It was finally upon a family friend's recommendation that his mom bring him in to Maximize Chiropractic, which was the only neurologically focused chiropractic office in Sacramento. We ran these insight scans. We built a fully customized care plan that was catered around his nervous system. We started with this foundation first. We didn't start with the label, we didn't start with his symptoms, nor did we address the symptoms that were under the control of his actual nervous system. The doctors had already worked on the gut. They had already tried to control his inflammation. However, the one thing that they had never measured nor actually helped was the foundation, which is his nervous system. Now, as soon as we started to work on this system, Caleb's tics reduced by 90%. His grades started to finally climb back up and his mood started to stabilize. His mom expressed that he was easier to direct and more socially engaged with his peers. Once his nervous system started to become stable, his health actually started to improve. You got to first understand the difference, though, between PANS and PANDAS. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder, associated with streptococcal infections. The immune system mistakenly attacks healthy brain cells after a strep infection. Where PANS is a broader category. It covers cases triggered by irritants other than strep. It can be mycoplasma and molds, influenza or Lyme's. It's a viral or bacterial infection that starts this. The immune system is responding to an infection and again attacking healthy brain tissue, specifically the vasoganglia, which governs movement, habit, and emotional control. The signs include sudden and abrupt onset to OCD and severe restriction in food intake, plus at least 2 neuropsychiatric symptoms: tics, anxiety, emotional instability, developmental regression, deterioration of school performance, and sensory or motor abnormalities, and other neurosomatic symptoms like bedwetting or sleep issues. Most cases affect little kiddos, 3 to 12, and most of these kids are already exhibiting mild to moderate health challenges before the onset of these new challenges, and that is the most important discussion yet. The signs that parents often miss or are actually being told to just ignore is that the medical community, even the integrative and holistic fields, doctors cannot agree on this diagnosis. Regarding all of these challenges, the families see their child's neurophysiology go haywire. They see their child change overnight, and the change is real. The diagnostic dispute going on in medical land far off does not matter to help this child. They have zero validity in helping your child regain their health regardless of their agreement. The hallmark highlight of these conditions is the speed. It's the onset of symptoms that are abrupt and severe, and parents describe it as an explosion. Their signs oftentimes appear overnight, and it can happen even within days of a particular illness. The motor tics like eye blinking, facial grimacing, or head jerking. The vocal tics like throat clearing, grunting, or repetitive words. Sudden OCD-like expressions, whether it's fear of germs, checking and counting, extreme hand washing, separation anxiety, rage, developmental regression, or new bedwetting, handwriting challenges, and they change overnight, the sensory sensitivities, and the school performance generally starts to drop. All of these individual symptoms show a fully overstimulated and dysregulated nervous system, which brings us to this perfect storm of events. The story is simple. Millions of kids get strep every single year without their lives having any residual effects. Most just get over it in about 7 to 10 days. So why is it that your child came into contact with the exact same bacteria that millions of others defend off without any harm, yet their body reacted so differently? And this is an important topic for what we're going to discuss. Strep is not the entire story. We know that strep affects some people in a very minor way. The majority of people get over it, no big deal. There was a load building years before the onset of these new symptoms. The strep is the straw that broke the camel's back. Everything had already stacked on, and that's what we call this perfect storm. This is how we address our PANS and PANDAS patients differently. We don't go back just the day that the chaos broke loose. We go all the way back. Fertility, pregnancy, delivery, and early childhood development. The perfect storm has 3 layers. This first layer is maternal and prenatal distress. Hormones, that maternal hormones, stress hormones especially, cross the placenta, and they can affect the developing nervous system and immune system calibrate their baseline in this environment in utero. Layer 2 is birth trauma and birth interventions. Forceps, vacuum extraction, prolonged pushing, induction, and emergency C-sections. Real mechanical force on an infant's neck and head, their brainstem, where all of that neurological expression occurs. This is the exact region where the vagus nerve also exits the skull. And it's why that matters here so specifically, is that the vagus nerve is the immune system shutoff switch. When vagal tone function is compromised early, inflammation has no break, which is why patterns we see in these kids long before strep ever enters the picture is also an issue. The third layer is early and often toxic overload. Repeated antibiotics, reoccurring infection, gut disruption, environmental exposures, and sustained stress across the toddler and early school years. Timing and frequency of strep infections matter more than the infection itself. A nervous system will reserve handles to a depleted on this account. Clinically, we consistently see softer signs of dysregulation and dysautonomia in kids' histories before the strep ever hits. Colic, reflux, chronic ear infections, constipation, poor sleep. The strep is the spark. The foundation is already shaky and unstable. This is why it feels like a roller coaster. You're fighting the spark while the storm underneath never has been addressed. The more you add inside the body, the more disorganization occurs. The conventional care will show change, but it oftentimes plateaus. Antibiotics target bacteria, but do nothing for the underlying neurological picture. Research shows that 25% of antibiotic prescriptions are actually unnecessary and the child would have healed themselves. When we look at behavioral therapy, it addresses the symptoms, but they can never reach the nervous system itself. Now, diets like anti-inflammatory based ones, detoxes, and supplements, they're incomplete when used solely alone, especially if the mechanics of that nervous system and body cannot function. Without addressing subluxation and dysautonomia, families stay stuck on this roller coaster of chasing symptoms and managing symptoms with medications or supplements. There is a path moving forward, and once you incorporate this, other therapies start to build much stronger. Neurologically focused chiropractic care targets the root cause, which is nervous system dysregulation. Subluxation is neurological interference, which is just a misaligned bone that affects the nervous system collectively. It disconnects how the brain and body actually communicate. We use insight scans that measure autonomic activity, muscle tension, and vagus tone. We use very gentle, specific adjustments to help the neurospinal system regulate and adapt to these stressors, and it will allow their bodies to restore support, things like sleep, mood, focus, and immune resilience. Care works alongside integrative medical approaches, functional medicine, or therapy plans. It doesn't combat them or work against it. It simply complements their therapies as their bodies start to work better. If your child is caught on the PANDAS roller coaster, one flare-up after another, one label after another, one medication after another, there is another layer worth exploring. Neurologically focused chiropractic care is not a cure for PANDAS. It helps support your child's immune system and ability to regulate and adapt to allow their body to heal from inside out. Caleb's story in the beginning of our conversation is one of many. With the right foundation in place, your child can look and see a difference in the future. Click on the link below. Send us a DM or schedule a consultation today. My name's Dr. Tim Nickel, and we're here in Sacramento. Your child does not need any more labels. They need answers, and that's what we are here to provide for you.